and Child Health Project of World Vision for the opening statement. Sir Romeo, the floor is yours.
Thank you, ma'am. Thank you also for our partners, partner agencies for coming to this activity, and also to our media partners. So, just to start up with our project with Korean International Cooperation Agency is the Maternal Newborn and Childhood Project, and we cannot deny that teenage pregnancy is part of the maternal health in general. So that's why we are one of our activities is to have this policy forum on teenage pregnancy. So that's why we invited different government agencies so that we can discuss on how we can collaborate and strengthen policies when it comes to teenage pregnancy and address the current situation in Eastern Visayas. So now I'm opening the floor to all our media partners.
All right. At this point, we will.
Okay. Thank you for question, but I am not representing Kuika, but I think I can answer that question. So, actually, the Eastern Visayas is a very strategically important area for the Kuika, Korea International Cooperation Agency. That's why, as far as I know, they already funded 3 different projects, but all of them is related to the maternal health and the reproductive health in this region. So one is, as Romeo said, is Kuika funded an MNCH project, which is implemented by the World Vision currently from the 2021 to 2025. That is one. And this year from the February, Kuika launched another project with 3 UN agencies, UNFPA, WHO, and UNICEF, which this project is specifically focused on the reducing teenage pregnancy only. Then there's another one funded by Kuika as well, which is implemented by the Global Care, based in the Leyte. So they are working in the 3 municipalities in the Leyte. So there is another Kuika project which is about reproductive health. So which means Kuika very just specifically invest a lot of resources in this region to reduce the teenage pregnancy.
Here's my question now, because it was only for clarification of what the forum is regarding the policy forum, are we proposing some policy changes in terms of how we look at teenage pregnancy or laws that are governing teenage pregnancy, RH law and everything, or are we suggesting maybe a paradigm shift on how we view it, how the different agencies should look into the problem of teenage pregnancy?
All right. So, who could answer that? Yes, we have Ma'am Vanessa Retrema of World Vision po.
Thank you for that question, sir. So actually, I have 2 points for that. As you have heard in the policy, we have so many existing laws that actually would like to also address the problem of teenage pregnancy. For one, we have the Responsible Parenthood and Reproductive Health Act in 2012. But the policy and the research shows that there are certain gaps in terms of implementation. So that's also the jumping board of the recommendations moving forward for different policy. So to fill in that gap, to address that gaps in terms of implementing that law, specifically from the national and most importantly down to the local level, because that's where usually the challenge is how to implement a national law. So we're trying to thresh out through the study what are the factors that really contribute to the prevalence of high teenage pregnancy in this region. So that's one. Another advocacy that we're also forwarding in World Vision is the passage of the Teenage Pregnancy Prevention Act. If you would know, yesterday it was already approved in its final reading at the lower house of the Congress, and it will be submitted to the Senate in the next succeeding weeks. This bill is actually in a way intended to address some of the existing gaps in the policies and programs of the national government to address this really national emergency issue around teenage pregnancy. So that's the two-pronged purpose of the policy forum, is to assess what are the gaps in the existing policies and how can we improve the implementation. At the same time also promoting the existing policy proposals at the Congress that will also address the existing gap of the implementation in relation to teenage pregnancy issue.
Alright, so I hope that answers.
For how many years na? Is there an LGU or LGUs in Region 8 na talagang tinututukan nila itong problema na ito? Na magiging model ng ibang LGU?
Maupay nga kulub, sir. That is actually a very interesting question because in a way, this is our way of advocacy or advocating the program of the DILG in partnership also with other national government agencies. First, I cannot name specific LGUs, but I'd like to share the information that the DILG advocates, okay, we promote the CFLGA. I don't know if you have heard already about the child-friendly local governance audit, where we assess the compliance of local government units, general compliance related to health services, both for not just for children but the mothers and fathers of these children. And this is an annual assessment or audit where we can get the specific names of local government units who passed or did not pass for this particular audit. We are happy to say that more than 50% of the local government units, 136 municipalities, and the other cities were able to pass well from 2021, 2022, and currently we are also finalizing the results of the CFLGA. I believe, I don't know if you've already heard that the seal of good local governance, we are soon to have the national validation, and for, again, there are certain indicators there where we can say or we can mention specific LGUs who passed the social protection governance area. Sir.
Alright, thank you, Ma'am Giselle. How about RD?
Good afternoon, everyone. I also would like to answer some of the questions posed by Mr. from RMN. We, as what Giselle said, actually, most of our local government units are actually, to a certain extent, have somehow made some impact as interventions as far as adolescent health is concerned, or teenage pregnancy for that matter. But if I might cite one specific LGU that has actually made somehow to a certain extent impact in addressing teenage pregnancy is the city of Tacloban. The city of Tacloban actually was very adamant as far as implementing interventions addressing teenage pregnancy in the city, being an urban area and a highly urbanized area for that matter. They even, for one, very specific, it's very important that you have an evidence-based data in your interventions. And with that, they were able to come up with, it's funded by the local government units, the city itself. They conducted a study on adolescent sexuality and fertility survey, just like pattern after the young adults fertility survey just presented by Karen Tolentino earlier. And that particular survey shows that teenage pregnancy in Tacloban City parallel to the result in the national level. And with that, they come up with some interventions, in fact, interventions, programs, and policies to address that. They even come up with a mechanism that will actually address or provide services, particularly they're able to establish what we call service delivery network, information service delivery network that serves as a referral pathway to certain services that we made available for our adolescents. who need services, particularly on counseling and other productive health services. That's one of the LGU that actually, and they even provide some budget relative to that. And it's based on their GAD. The source of their fund is their GAD, General Development Fund, in helping address the incidence of teenage pregnancy in Tacloban City. There are other cities that also be responding to that. Ormoc City is also one. Borongan is also one of those LGUs, and even Baybay. But then those are some of, that's as far as cities is concerned. There are also municipalities that actually been doing some interventions, but again, this needs a collaboration with each and every one. So we have to actually, sana lahat ng mga LGUs should be responding to this, because at the end of the day, this particular issue or concern is not just the concern of one agency for that matter, but this concern is the collaborative effort of each and every one of us. And I would like to take this opportunity to thank our development partners, World Vision, Global Care, COICA, the funding agency, for actually bringing teenage pregnancy at the international platform for discussion and helping us address this issue. This is multifaceted concerns, and this needs multifaceted concern and interventions. Thank you so much.
All right, thank you, Director. I believe Mr. Hermo Severino of TUH will add.
Just a rejoinder with the answer of Director Pulma of CPD. By the way, Mr. Mark Severino, the Regional Adolescent Health and Program Manager of Mr. Visayas. With your question, Sir Kevin of RMN, is there are LGUs that focuses on this problem, which is the teenage pregnancy. Currently here in Region 8, majority or 6 of the provinces are already implementing the CADA network. This is a strategy of the Department of Health that focuses on establishing an adolescent-friendly health facility, ensuring that all of the service providers are providing adolescent-friendly services, not just only in RHUs, but also in hospitals as well as in the learning institutions. Currently, we already conducted a province-wide implementation of the CADA network in the province of Biliran. Then maybe this year, once the funding is already being transferred to the local government units, the rest will follow, which includes Samar, Leyte, Southern Leyte, Eastern Samar, Northern Samar, Tacloban City, and Ormoc City. Also, aside from the CADA network, there are also other strategies that are being implemented in some provinces, which includes Samar. Samar has a lot of strategies, which includes the establishment of Sirak Kabataan. This is actually a province-led. It is led by the Provincial Youth Development Office under the National Youth Commission, which focuses on mental health and adolescent pregnancy. So I guess in Region 8, all of the provinces and cities are actually making this as a priority, which is being part of the SGLG checklist. But aside from that, because we also have partnership with the local youth development office, which are being mandated by the National Youth Commission, this is being funded. Yun na po, sir. Thank you.
All right, thank you so much.
I'd like to commend COICA because this policy forms very timely, because just in the House Bill 8910 was already passed in the third reading at the Congress, and we're looking forward that this will be accelerated soon by the joint Senate and the Congress altogether. And looking at the data presented earlier, we saw the decline of teenage pregnancy at the using the National Demographic Health Survey and the Young Adult Fertility Survey. At the national level, there's a decreasing trend among teenage pregnancy. Similarly with Eastern Visayas, with 6.9 to 4.9%. However, if we're going to translate it to absolute numbers, these are big. But we need to look at the new phase of teenage pregnancy, which are not yet being unveiled. Who are they? The 10 to 14 years old, the children, the teen adolescent victims of gender-based violence. And those data are essential that we need to get from DSWT and the ILG so that we can address the problem. Thank you.
I just want to clarify, I just want to emphasize that while teenage pregnancy at the age 15 to 19 is decreasing in the national level, even in the regional level, specifically for Region 8. But what is quite apparent, and we need to address this, is because 10 to 14 years old, data on teenage pregnancy is rising. In fact, it's presented there later that from a level of, from 2011 to 2021, that's increased from level 20 to right now, 2021, we're able to record 70 of them. Our adolescents, they are actually considered children, having children of their own at the age of 10 to 14. And you can just imagine the impact of their own lives related to this. I just want to emphasize so that we can also collaboratively address this rising incidence.
All right.
Good afternoon. Well, what's the status of Department of Education right now in terms of abstinence-only comprehensive sex education? Kasi merong mga instances na when we talk an adolescent, when we talk about condom, ay nahihiya. So parang out of curiosity ba yan? Or what kind of quality awareness and education for them that we can say sex education in schools are effective?
Thank you very much. Good afternoon, everyone. So again, I'm Eden Dada from the Department of Education. I'm the Project Development Officer for, and at the same time, I handle the Learner Formation Division of the region. So I work closely with the children. I am also the Regional Coordinator of the Learner Rights and Protection. So talking about adolescent health and also reproductive health concerning adolescents is really my work at the regional level. Regarding the status of the implementation of the program, the RH bill in the region, the Department of Education is working seriously on that. In fact, that's stipulated in the RH bill under Section 11, Rule 11 of its implementing rules and regulations are the specific responsibilities of the Department of Education. One of which is the age and development appropriate comprehensive sexuality education. So because of this, we work with development partners in the implementation of comprehensive sexuality education. But I would like to emphasize that it must be age and development appropriate comprehensive sexuality education. And with this, I'd like to take the opportunity to really express appreciation to COICA. We have an existing partnership with COICA, World Vision, with the World Health Organization, with the UNFPA, and other development partners in the implementation of this program. We have an existing program in Southern Leyte, in Samar, and now we are working with Northern Samar and Eastern Samar, where incidence of child pregnancy is really rising. So the figures are really alarming, and so we're working hard on that. Now, on your question on our stand on the abstinence-only issue, perhaps that is because of the stand also of the central office, the Fed Central Office, to really not allow the distribution of condoms inside our schools. We still maintain that stand. We do not allow the distribution of condoms inside our schools. Nevertheless, we intensify education, advocacy, and and education campaigns in our schools that to raise moral awareness, to intensify, and also emphasize, and also integrate moral regeneration into our curriculum, into our schools. This gives actually us the call to call for a comeback of the GMRC into our curriculum. So for the kindergarten to grade 10 curriculum of the K-12 curriculum, we already have GMRC, and GMRC is already included. I believe during your times, GMRC was a subject in school, and now it's already included. But the implementation will still be in 2024 to 2025. That's the start of the implementation of the new curriculum. And also, there is already the Makabayan subject because of the matatag agenda of our Vice President. And I would like to emphasize the third component of the matatag agenda, which is give support to our learners so that they will be able to face life with resilience, and all of the needed life skills must really be incorporated in the lives of our learners. And this precisely includes the knowledge on comprehensive sexuality education. So still, I would like to emphasize it's on moral regeneration. Thank you so much.
Just a rejoinder siguro to help our friends from DepEd. Since DepEd has this stand not to provide condom, I guess in partnership, we need to establish our network for referral. Since this is already existing, teenage pregnancy, premarital sex is already existing, we really need to provide services. So if the stand of the school is not to provide condoms, let us refer them to the adolescent-friendly health facility, which can provide counseling, which can provide adolescent-friendly services, which includes the provision of our family planning commodities in order for us to prevent teenage pregnancy or another teenage pregnancy. Thank you.
Maybe I would like to clarify that we do not prevent our learners from using contraceptives. We do not prevent our learners from using condom. What we do not just allow is the distribution of condoms inside the school premises. So it's only the distribution inside the school premises. Our referral system is in place, sir. So we refer them to the appropriate offices. And also, we would like to emphasize also that we remove in our educational culture the taboo, because this is one of the barriers in the implementation of the program. We have identified this, and in fact, this was supported by the research presented by the UP guy this morning, that the social-cultural barrier is really prevailing in our region. So, we are talking openly about this, but we are just increasing the capacity of our teachers because this is still prevailing. This is still prevails. The culture is still there. So some of the teachers still do not want to talk about it, but we would like to train all of our teachers so that they will know how to do this.
One more. At the national level, we're partnering with the Department of Education, and we already have a convergence called CSE, ARH convergence, and this is already a policy. And there are capacity building among teachers, and we ensure that we monitor the CSE rollout, CSE curriculum. When we say CSE, there's a wrong connotation. When we say comprehensive sexuality education, it includes family planning. It should be integrated in the curriculum. So it's not only abstinence only being promoted by DepEd, but it's the entire family planning where children and adolescents will be able to learn at school. However, remember, in our RPRH law, there's still need a consent, which is a barrier among adolescents to access those family planning methods. Thank you.
It's true. That's one of, I think that's one of the limitations as far as the law is concerned. As far as RPRH law, it was actually passed way back 2012, but there's not TRO siya, simply because of some provisions of the law. And one of which is the provision or access to our adolescents to commodities or family planning commodities immediately without the consent. Because they're minor, the law says that we can provide, they can access all methods of family planning methods, except that they have the consent of the guardians, either parents or whatever guardians. But I think there's an existing law right now, the bill's being passed in the lower house, House Bill 8910. I think that will respond to the questions for sana naman ating mga adolescents can have access even without the consent of their guardians because they really need it. I think that particular provision is also included in the House Bill 8910. But there are some instances yata, conditionalities, and I think siguro si Dr. siguro pwedeng mag-address. But that's one of the response to the call for our adolescents that they want to have access to it even without the consent of their guardians simply because of some circumstances. And I think that particular provision, sir, siguro si Dr. na siguro kapag-ano doon.
Siguro in addition na lang in support for the provisions of services for our adolescent. Currently, we approve, it was being passed the HIV policy law that actually approving our adolescent ages 15 years old and above with some certain conditionalities. No? So as long as these adolescents are being sexually active already, they can access. But for those 15 years old and below, still, we need consent coming from our parents or guardians. In the event that our parents or guardians are not available, we can actually adopt the proxy consent, which is in the presence of our social worker and the presence of a witness. Thank you.
So we're down to our last 10 minutes. So 1 to 2 questions na lang po. So,
Ron from Manila Times. For Police Lieutenant Colonel Maria Luisa, what are some measures that PNP can employ to contribute to the efforts that are being done by the LGUs and NGOs to protect women and reduce teenage pregnancy in the country?
Good afternoon, sir. I'm Police Lieutenant Colonel Maria Luisa Lasanas from Regional Medical and Dental Unit 8. With the 5 focus agenda of our Chief PNP, one of that is the community engagement. So we are helping with the LGUs and other agencies with regards to that, with regards to decreasing the early pregnancy of our children, and maybe one of the factor is that it all starts in the family. So mostly, as I observed with the presentation kanina, it was not emphasized that those teenage pregnancy is from abuse. That's why I was asking kanina na is there mga abuse na noon. But then hindi siya talagang nakikita kanina. Firstly is sa family talaga mag-i-start yan. And then when more on kasi kanina is sa school, but then we cannot also blame the school kasi doon tayo mag-start with the family. But then the PNP is very visible, and then we have also trained WCPD officers, the Women's and Children Protective. So yun yung program namin. As long as nalalaman namin na may nagka-complain, so we are advocating it. And more on kasi is the stigma na hindi naman kasi nagre-report yung iba. And some reported pero ayaw nilang mag-go through pa dahil nahihiya. Yun lang po.
Good afternoon. I'm Rodney Kapal from Business Mirror. And this question is addressed to COICA and World Vision. I just want to clarify, is the Eastern Visayas your pilot area for the MNCH project? And if so, when did you start doing this project, and any updates regarding addressing teenage pregnancy in the region? And for the OH and the ILG, how do you see teenage pregnancy situation here in the region now that we're moving towards post-pandemic? Since it's stated in the report a while ago that there is a decline in teenage pregnancy for 15 to 19 years old in the region, and one of the reasons would be during the pandemic there's this less connection or personal connection with other people due to restrictions. So how do you see the future of or how do you see the future of teenage pregnancy in the region moving forward?
So for the Kuwaika Maternal Newborn Childhood Project, so we started the project in 2021. So we are now in phase 1 project until 2025. So about your question on how we address teenage pregnancy, currently we have different activity related to maternal health because we are the project is on maternal health, and one of the aspect covered by maternal health is the teenage pregnancy. So aside from one of our activities that I can say is we do capacity building for our VHW and barangay nutrition scholars. One of the activity we are currently doing and implementing is what we call the time and targeted care for families. So this model is a behavioral change approach model where we capacitate the barangay health workers who are doing their home visitation in a way where they can we deliver the holistic approach, not only addressing pregnancy or maternal health, but it's general. So because if we will look at it, there are lots of interventions, but still problem exists, and that is one of the ideas that we are seeing is on behavioral change. And the approach now is we give the ownership to the families in identifying their problems, identifying the solution, in order for them na makita nila agad kung ano yung, bakit nangyari ang isang bagay, ano yung pinaka-root cause ng problem, and they will identify also on how to address this problem. So that is one of our activity.
No, actually, this is not pilot. It's not pilot project. This is when Quika launching this program. Actually, this is 15 years long commitment. So as Romil said, this is first phase of 5 years. So in the first phase, World Vision is working on general maternal health improvement in the region. So as Romil said, we are working together with especially in the BMOC level, in the community and the municipal level, train the barangay health worker. So let the barangay worker make a household visit. Since the pregnant woman, the pregnant until their baby becomes 2 years old, they are going to visit at least more than 12 times in the timely and the target visit. So this is one community engagement. The second one is our intervention is increase the capacity and availability and the readiness for the health facility. So we provide the capacity building for the health worker, including nurse and medical worker in the health facility. Also, we provide the medical equipment, then also medicine, also consumable to increase the readiness and the availability for the health service from the health facility. And finally, we also working together with our partner to improve and upgrade our policy which is related to the maternal health. So this year we are working together with our partner, which is on reducing teenage pregnancy. But for the next year, we are working together also with the partner to upgrading our referral system. Because during our discussion with the community and the municipal level, we found still many pregnant women, especially from the barangay level, they are struggling to be referred to the higher level of a hospital. For example, this is emergency, but to get the kind of approval or just to get into the hospital, they need to wait sometimes 1 day or 2 days to get some approval from the higher level of hospital. So this is another some problem. So that is another our issue for the next year. So once we finish this first phase of program, then if we got show the very good performance together with your partner, Quika will just invest another resource for another 5 years. So in the second phase, we are focusing more on the teenage pregnancy issue and the reproductive health in this region. So that is our plan together with Quika.
Thank you, sir.
Now for the questions, probably for DILG and Popcom. Post-pandemic, the DILG with its mandate of general supervision and performance oversight, we continue to capacitate our local government units in terms in crafting their local plans, to have a lens na gender sensitive, and also to recognize the other needs, not just of our children, but those of the adolescent. And also, we have this joint memorandum circular with POPCOM and other national government agencies where we sustain our monitoring as to the LGU's compliance in organizing, not just in organizing, but also in implementing and also in coming up with PPAs relative to the implementing teams on the RPRH. So again, we would like to take this opportunity to thank COICA, World Vision, and our partners for having this kind of activity because tinitignan natin ang isa't isa face-to-face. We all have different pains, and it is very good talaga that we are talking with each other para at the local level nagkakaintindihan tayo. Again, maraming salamat sa inyo.
Just I rejoined her, I think. But you're right, sir, that the statistics that was presented covers the years wherein we have COVID pandemic strikes. So statistics shows that as far as teenage pregnancy is concerned, the study or the data was actually taken during that particular coverage, that particular period. So the 15 to 19 statistics that it has quite gone down a little bit we should also take into consideration the existence of the pandemic that actually limits the interaction of our adolescents aged 15 to 19 with their respective peers, simply because they don't have that, they have limited interactions. But based on the study, it is expected to rise again. And starting 2022, when the pandemic slackens, and it seems that we are now into face-to-face. Our school is now into face-to-face. So it's expected again to rise. So intervention should also be stepped up as far as addressing teenage pregnancy. And because of the implementation of the Mandanas ruling, the national government particularly is now requested to provide technical assistance to our local government units, who are actually the primary implementer of the reproductive health law, specifically teenage pregnancy interventions. That's why I'm also so happy that our local government units, especially our local government officials, are now very, very responsive to the call to address teenage pregnancy because it has something to do with economics. So high incidence of teenage pregnancy also means poverty for the locality and even the residents. So that's why as far as the CPD or Commission Population Development is concerned, we are not providing technical assistance to our local government units, capacitating them to plan out and make some budget in response to reproductive health services, including teenage pregnancy. And with DILG, thanks to DILG, it is now included in establishment of the local health centers. It's now part of the performance indicator of our local government units, so that to a certain extent will make some focus talaga in the establishment and specifically in our teenage pregnancy issues. Because that particular teen center serves a hub for a referral pathway, wherein all the services that our adolescents need can be responded to through referrals to certain facilities that's not services that might not be available in the center, and more so services that they might find it accessing at the health center simply because of the sense that bangin ko may da sakit, so they don't want to access services at the health center. That's why we have teen centers, both at the community and school-based centers. So again, as I have said, statistics shows that it might increase, and this therefore needs a collaborative efforts of each and everyone to address that.
All right, thank you so much. I know you still have lots of questions to ask from our panel here. However, we're pressed for time, and we will just invite
for being here with us. Most importantly, our partners from the Department of Health, Department of Education, Population Commission, the ILG, PNP. As we have mentioned a while ago in the policy forum, the problem or issue of teenage pregnancy in a very intricate and complex one, and it cannot be addressed by just one single agency. It might be a health emergency problem, but solving that requires different aspects, addressing different factors. So I think this is just the start of coming together, discussing the problem, coming up with solution, but most importantly, implementing those action solution moving forward. This is an emergency issue, so it really takes, health emergency issue. It takes everyone, and it takes the urgency, to do the right thing for us to be able to ensure a healthy and fulfilling life, especially sa mga teenage and children natin here in the country. So maraming salamat po, and we hope to continue our partnership, not just today, but moving forward. Salamat po.